Over 100,000 people died in the U.S. from a drug overdose in the last year. Fatal overdose rates are rising most rapidly within communities of color.
The Michigan Opioids Task Force has formed the Racial Equity Work Group to address growing disparities in overdose deaths among Black, Indigenous, and peoples of color across the state.
Joining us now to talk more about this, Ashley Daniels, lead organizer for Michigan Liberation's Care Not Criminalization team. Ashley, how are you?
Hey, how's it going?
Good. Glad you're here. We want to start with some data. How big is the overdose problem when it comes to people of color?
Well, yeah, thanks for asking. So when it comes to people of color, they are overdosing and having overdose deaths at a rate of 2.2 higher than their white counterparts.
So yeah, it's significant, and that's why this work group has formed. Tell us a little bit about the group and some of the goals that you guys have.
Sorry, my godson, he's coming in the room. I'm babysitting at the moment. But yeah, so really excited about this group. The group is called the Racial Equity Work Group, and it's comprised of 15 members. And excuse me. Please, thank you. Sorry about that.
You're good.
It's comprised of 15 members who have personal and professional experience with public health, with drug policy, harm reduction, mental health. And this work group is 80% BIPOC, Black, Indigenous, people of color. And the work group has predominantly 3 goals. The first goal is to commit an ongoing learning from BIPOC communities and folks with lived experience to analyzing the data by race and ethnicity. And we're working with racial justice advocates on health equity for people who use drugs, live with mental health considerations, and others affected by the overdose epidemic. The second primary goal is to develop a strategic plan using the key findings and lessons from talking to these communities with lived experience. And with this strategic action plan, it should help guide the opioid task force in developing a state opioid strategy and transforming systems to be racially equitable. And the third primary goal is to act as an accountability partner to the task force and ensure that they support racially equitable actions and challenge those racially inequitable actions.
And in terms of the community, what is our responsibility in all of this? How can we help?
Oh, yeah, there is plenty of ways. So as far as the community goes, one of the biggest things that can help is the stop the shame and the stigma that we have towards people who use drugs or live with mental health considerations. Just about everyone knows somebody who does some type of substance or lives with a mental health consideration. And besides, working towards ending that shame and stigma that we tend to put on ourselves and others, we need to start having these conversations about, what are ways that people can still feel whole, still have their respect and dignity in choosing to use drugs or not. And also, it's very important for us to have community members input on some of these recommendations that's coming out, because what treatment, recovery, or any of the other pillars that we're making recommendations look like, let's say in Sault Ste. Marie, it doesn't look the same as it does in Wayne County. And for an example about Wayne County and the racial disparities that's happening right now is that, last year there were a little over 3,000 overdose deaths, and 1/4 of them came from Wayne County. And that's because, there's not much treatment options, recovery options. There's not really places for people to go. And the places that they do have there is a cap on like how much time they're able to spend there.
It's Ashley, it's a daunting issue, absolutely, and it's one in need of new approaches. We appreciate your time tonight. We've got to cut you off there, but we wish you luck in your endeavors.
All right, thank you, and just make sure you stay tuned to the recommendations that the work group is going to be putting out there. It should benefit all of us and save many lives as well.
Absolutely, we sure will. Ashley, thank you.